Welcome, ladies and gentlemen. My name is Nisha from Walkagain Rehab Private Limited. It is my pleasure to introduce our esteemed guests joining us today from Kuala Lumpur, Malaysia, Ms. Shruti and Ms. Christina from Rehab Malaysia, Sdn Bhd. Our webinar topic today is patient-centric approaches in neuro rehabilitation, admission, and recovery. Neurorehabilitation is a specialized process aimed at aiding recovery and improving the quality of life for individuals who have experienced neurological injuries or conditions such as stroke, traumatic brain injury, spinal cord injury, multiple sclerosis, or Parkinson's disease. As medical science and technology advance, the focus in neurorehabilitation has increasingly shifted towards patient-centric approaches. These approaches prioritize the individual's needs, preferences, and goals of patients, recognizing that personalized care can significantly enhance recovery, outcome, and patient satisfaction. So, ladies and gentlemen, without further ado, please welcome Ms. Shruti, who will delve deeper into this exciting topic. Over to you, Ms. Shruti.
Thank you, Nisha, for such a warm welcome. Hello, ladies and gentlemen. Firstly, many thanks for making our webinar series 1 and 2 a huge success. Shruti again here from PERKESO Rehabilitation Center, Malaysia. Walkagain, next slide, please. All right, so today it's such a wonderful topic, webinar series 3 on patient-centric approach in neuro rehabilitation, admission, and recovery. At PERKESO Rehabilitation Center, we are very proud to say we involve various healthcare professionals, such as right from physicians, nutritionists, therapists, psychologists, such that our patients can benefit from multidimensional approach to foster interdisciplinary collaboration at their recovery. We also make sure we actively engage patients in discussions about their treatment preferences, which is very important. When I say we are into their treatment preferences, including topics such as preferred method of communications, involvement in decision-making, and specific goals, because it differs from patient to patient, which they wish to achieve during the rehabilitation and recovery process. Also, most importantly, as a first caregivers, leading service of rehabilitation, we understand the patient's lifestyle, which is crucial in tailoring their treatment plan. For example, if a patient like me who has a sedentary desk job, we may recommend regular breaks or specific exercises to prevent musculoskeletal issues, because they will be definitely sitting for a prolonged time. We also try to be sensitive to patients' cultural background, because today we have patients coming in from across the globe. We have patients coming in from Bangladesh, India, Sri Lanka, Australia, Middle East, and you name countries, yes, we have patients coming in from there. So we try to consider any such cultural specific needs or preferences when designing their treatment plan. Also, last but not the least, one of the key factors where I'm proud to tell is socio-economic factors, be it financial constraints or access to the transportation. We ensure as this creates an impact in patients' ability for their treatment plan. So we make sure we assess and address all such factors to ensure that the plan is very feasible and very realistic for the patient. Walkagain, next slide, please. And when we talk about the admission process, we are proud to announce that we are also doing free teleconsultation for all our international private paying patients from across the globe. And teleconsultations, of course, will have synchronous and asynchronous modes, wherein patient we talk live to chat with our multidisciplinary team, or at a cases where the caregivers record the movements of the patients or disabilities of the patients and pass it to us for the further confirmations and the rehabilitation plan. As a part of it, after when the patients are coming directly to our center, we do the initial assessment to assess them better face-to-face and live conditions. From then, we will have to take up this tailor-made rehabilitation plan. where we will be setting the goals collaboratively that involves the family and caregivers as well. Also, ladies and gentlemen, with this, we also provide the visa letters and travel assistance to all the patients that are traveling from across the globe to our PERKESO Rehabilitation Center, Malaysia. Not taking much of your time, I'll pass the floor to Ms. Christina, subject matter expert of patient acquisition. Ms. Christine, over to you.
Thank you so much, Ms. Shruti, for the nice walkthrough. All right. Very good day, everyone. Let me take the opportunity to share with you more about the patient-centric process flow, right? And I believe like many of you are aware of the patient recovery process, which I have shared during our one-to-one meeting, online meeting earlier. Let me rekindle for all of you and let's jump into the slide. All right. And in PERKESO Rehabilitation Center, we emphasize meaningful approaches, right, that prioritize the needs, preferences, and values of our patients in all aspects of their care. We are providing a personalized care that is tailored to their individual patient's needs rather than is a one size fits for all approaches, right? Since we are receiving a various types of patient cases in our rehab center, we will make sure that patient is not recover physically, but also in the overall well-being, right? So once we receive a patient inquiry, the first step we will be doing a patient screening via a phone call and to set a teleconference scheduling, right? So here, patient required to complete a Google inquiry form where they able to upload their medical reports and so on, right? Then this data we will pass to our medical team so that we can schedule a teleconference only for international patients, and for local patients we will restrict to do an initial assessment with our medical specialist, right, headed by Dr. Liana. Right here, the objective of the teleconference is to understand patient's current illnesses condition and also the rehab goal plan, right? And then all this data will be compiled and will be shared to our rehab team so they can prepare a comprehensive rehab plan. And that is where we also prepare the interim quotation for the patient. So patient can go and discuss with the family members and come back to us with the confirmed travel dates. So that is there when we can proceed with the bookings here in our rehabilitation center. Right. And at this point, we require a patient to notify us at least 14 working days before on their travel plan so that I can do the rehabilitation booking admissions in our center. And also to arrange on their transportation and do the arrangement for receiving patient at the KLIA airport. All right. Here, I would like to emphasize as well, we collaborating with Malaysian Health and Tourism Council so that we can provide an exclusive meet and greet services, especially for all our international patients. So there will be a designated team to welcome patient, especially international patient in our KLIA airport, and to help to cross the baggage immigration process and usher patient till the transportation. Right. In case that a patient required an ambulance assistant, that can be arranged as well, right? And also, we can help to provide, as Shruti also mentioned just now, provide a supporting letter for patient here, since some of the countries that require a medical visa to travel. So we can provide a supporting invitation letter for the patient. And that's come the second stage here, all right, where once a patient is here in our PERKESO Rehabilitation Center, we will do a physical assessment, all right, a physical initial assessment, so that our medical expert can understand more on the patient condition physically, right? And during the rehabilitation process, the overall process, we will make sure that our medical team to do a rigorous monitoring in terms of like every 2 weeks once, we will do a assessment to see on the patient progress, right? Then if let's say patient required or need any revise of the rehab plan extensions, our medical experts will advise the patient accordingly, right? And finally, once the patient achieve their rehab goal plan, they can safely return to their home country, right? And during the exit, right? During the exit, we will provide a post-discharge documents as needed, such as basic exercises and diet plan will be given to the patient so that once they go back to their home country, they can practice on their long-term recovery process as well, right? Next slide, please. Walk again. Okay, in PERKESO Rehabilitation Center, we give a much important when it comes to patient recovery process. And I would say each and every patient recovery journey is unique, right? As a healthcare professionals, we play a crucial part role, yeah, in helping patients to regain their health and independence after their disability. So we try to understand what is patient's rehab goal at the first, and we make sure that patients participate proactively in every therapy sessions, right? And which can give a lot of improvement in their rehabilitation treatment journey, right? In also in our rehab PERKESO Rehabilitation Center, we make sure our team gives a continuous emotional support to all patients by fostering a culture of empathy and compassion. And as a leading provider, neuro rehabilitation provider, PERKESO Rehabilitation, we have a unique opportunity to make a meaningful impact on each and every patient's life. So how we are doing that? By providing a comprehensive care that addresses patients' physical, emotional, and also social needs, which we can help them to achieve optimal recovery outcomes before sending patient to their normal life when they go back to their home country, right? And let us see, next slide, please. Walk again. Okay, let us see from the eyes of the patient. What does it mean for our patients when we talk about outcomes, right? It means so much more than just a successful treatment, rehabilitation treatment plan, or a certain level of physical functions. It means giving them their life back, right? For our patient, outcomes means being able to return to their daily activities without pain or with the lesser pain or without any limitation, right? It means being able to play with their children, pursue their hobbies, and live a life on their own terms. We've seen patients, a lot of patient success story here. It means having independence and control over their own bodies. And in PERKESO Rehabilitation, I don't know how it's for those who are outside, but we know that outcome are not just about a physical function. They are also about an emotional and also a psychological of overall well-being. So in PERKESO Rehabilitation, we help patients with a chronic pain management in terms of managing their stress and anxiety and find a meaning and a purpose in their lives. Right, our process improve patient outcomes as we prioritize on patient-centered care. So we listen to our patients' concern at the foremost first place, involve them in every steps of the recovery process, and empower them to control their own care, right? And with this, passing the floor to Mr. Bhaskar so that we can see some case studies and success stories video.
I'm 57 years old. Both my feet, I couldn't move. And then once I went for the MRI, results, there was pus in my backbone, level T10 and T11. So after 2 months of operation, on the 4th of January, I reached Pusat Rehabilitasi PERKESO, Melaka, on the 4th of January. So I came in a state where I couldn't transfer from a wheelchair to bed. Environment here is very good. If you take the opportunity that they give you, the service that they give and the classes that they arrange us to go really plays a big part. You have to have strong courage and you have to be determined in what you do. I don't know how to put it, but this place is really a very good place. Cyberdyne played a very big part as well. In fact, most of the classes were all to my benefit. Attend all the classes that they arrange for you. Take it to your limit that you can do, because be positive, be happy. Thank you, Pusat Rehabilitasi PERKESO Melaka.
For the first 3 months, the hand was not moving at all. So when I came, and basically this machine, when I used, it has actually changed my lifestyle back to my previous life where I was active. Hand is essential for me in everyday life because I have to work as well as I have to do my house chores. So with the help of this machine, actually it has helped me in my daily activities, and with the help of my parents, and they are also very happy that with this Cyberdyne technology, it has actually changed from me being partially disabled to able. In the near future, I hope that Cyberdyne can maybe take our feedback as a user, take more feedback in for them to use for their R&D purposes, so that they will come out with a better and maybe more user-friendly product to assist people like us in equipping them for their future, and also for their family, and also for their continuing their life as a normal person. Okay.
Thank you, Walkagain, for that very inspirational testimonial videos. That's truly inspiring. So, ladies and gentlemen, patient-centric approaches in neurorehabilitation emphasizes the importance of individualized care that respects and responds to the unique needs and preferences of each patient. By focusing on comprehensive assessment, personalized goal settings, continuous monitoring, patient education, sociology support, and community reintegration, these approaches aim to optimize recovery, outcomes, and enhance overall quality of life. The ultimate goal is to empower patients to achieve the highest possible level of independence and well-being. So before we end this session today, ladies and gentlemen, allow me to go through some frequently asked questions. So question number 1, why is a patient-centric approach important in neurorehabilitation? Patient-centric approaches are important because they enhance patient engagement, satisfaction, and adherence to treatment plans. Personalized care can lead to better recovery as treatments are tailored to the specific needs and goals of a patient, improving their quality of life. Question number 2, what does the admission process involve in a patient-centric neurorehabilitation program? The admission process involves a comprehensive initial assessment by a multidisciplinary team to evaluate the patient's physical, cognitive, initial, emotional, and social status. This includes reviewing medical history, conducting physical and cognitive evaluations, and setting personalized goals. Question number 4. What role do patients and their family play in the recovery process? Patients and their family are actively involved in the recovery process. They participate in setting goals, making treatment decisions, and providing feedback on the care received. Family members are also educated on how to support the patient's recovery at home. And last but not least, question number 5. How is progress monitored during the rehabilitation process? Progress is monitored through regular checkups and re-evaluation by the rehabilitation teams. Continuous assessment helps to track improvement, identify challenges, and adjust the treatment plan as needed to ensure optimal outcomes. So before we end the session today, ladies and gentlemen, does anybody have any questions they would like to ask us? You could put your questions in the chat box.
Okay, I think we have a question from the audience side. So, hello, I'd like to know if there will be any language barrier for the patients who don't speak English. So far we do not have any language barrier because we have a team of interdisciplinary people who also speak multiple languages. So we have translators with us. So I don't think so that will be a problem at the moment. So already we have patients coming in from Middle East and parts of the world. So we are already doing good. So we do not have any language barrier at the moment. Any more questions, audience?
Okay, ladies and gentlemen, I don't think there's any more questions from the floor. If you do have any, you can always reach out to us via our email addresses. Thank you so much today for joining this amazing webinar. We hope to see all of you again in our next webinar, Series 4. Looking forward to seeing all of you. Please take care and bye-bye.
Thank you all. Bye-bye.
Thank you, everyone. Bye.